at TaylorvilleDailyNews.com.
Your information station, WTIM.
Welcome to the WTIM Morning Show. I'm Avery Cooper. Landmark of Taylorville proud to bring you this stream on TaylorvilleDailyNews.com's Facebook and YouTube on WTIM TV. Landmark of Taylorville. You'll always do better with Landmark and People's Bank and Trust, where they put people first. I'm here on the phone with Pana Community Hospital's Perioperative Services Manager, Stephanie Anderson. Great to have you here, Stephanie.
Thanks for having us.
Also over here with Anesthesia Manager, Bob Ludwig. Great to have you here, Bob.
Nice to be with you.
So, tell me a little bit about what's been going on in the surgery department at Pana Community Hospital.
Sure. A lot of exciting growth been going on around here within and out of the hospital as construction has begun for our new MRI unit. And specifically for surgery, we've been thriving here with our total joint service line that was started about 18 months ago. And since then, we've been providing same-day surgery for total joint replacements of knees, hips, and shoulders for just throughout the community. And each one of our patients has had exceptional results. But we also have some new and exciting news to share from our department here at Pana, and that's that we have reestablished and expanded our urology service line. So we are now back to providing urology services to patients throughout our community.
Can you expand on that urology service line a little bit?
Sure, of course. Dr. Morgan is the newest addition here at Pana Community Hospital in our surgery department. He is a board-certified urologist that has been serving Central Illinois for over 24 years with his expertise in urology. In addition to Pana Community Hospital, he provides services at Decatur Memorial Hospital, Springfield Clinic, HS, Good Shepherd in Shelbyville, and Lincoln Memorial Hospital. Dr. Morgan started his services at our hospital around early May, and his clinic is held on the first Thursday and fourth Wednesday of each month. And his nurse practitioner, Jennifer Sunderland, also sees patients on the second Tuesday of each month. And this urology clinic is located in our medical mall here at the hospital. Dr. Morgan provides various services and treatment for options for urology issues, and some of the procedures that he performs are cystoscopies to examine the bladder, care and treatment of kidney stones and kidney cancer, bladder tumors, bladder cancer, urinary and bladder problems such as blood in the urine or incontinence. He also does laser therapy, vasectomies, treats prostate cancer, ED, and many more. And seems for the most part his urology cases are short but great results. And as we continue to grow this service line, we anticipate Dr. Morgan picking up more surgery and clinic days each month.
How can people use this service line?
Okay. If you or a family member are experiencing urology issues or would like to just discuss concerns or learn more about treatment options, you can make an appointment with your local urologist, Dr. Morgan, by calling 217-562-6238. And any one of the staff will be happy to help make an appointment or help guide you in the appropriate direction.
What other surgical services do you provide at Pana Community Hospital?
We offer many other specialties here at Pana Community Hospital, including orthopedic services, such as total joint replacements and sports medicine treatment, including procedures such as rotator cuff repair, biceps repair, tendon and fracture repairs, ACL reconstruction, arthroscopies of the hip, shoulder, and knees. And our orthopedic surgeons are Dr. Sams and Dr. Sullivan from Decatur Orthopedic Center, Dr. Elbitar with SIU, and Dr. Tapscott with Springfield Clinic. Our ophthalmology services include cataract and other eye surgeries with Dr. Allward from Prairie Eye out of Decatur. We also have two podiatrists, Dr. Ott and Dr. Brown, who offer podiatry services here at Pana, including fracture repairs, bone spurs, toe amputations, and many other treatments and surgery of the foot and ankle. Our anesthesia staff is specially trained to place blocks for different cases to help assist with managing post-operative pain and maximizing recovery, But I'll let Bob kind of touch on that a little bit later when he pipes in. And then we have Dr. Anawana from Decatur, who is our general surgeon. Dr. A specializes in colorectal procedures, including screenings for colon cancers. He performs general surgeries such as removal of skin lesions, breast lumpectomies, mastectomies, hernia repair, removal of gallbladder, and many more. So you can see we offer a wide variety of specialties and surgeons to provide your same-day surgery needs. Our cross-trained, experienced surgery team works really well in collaboration with our surgeons, anesthesia, and other ancillary departments to determine and provide the best treatment for all of our patients of all ages, anywhere from having the surgery through the rehab. We also offer surgical services to a wide range of patients, aging from pediatrics to seniors.
Isn't there a new surgery department recently built at Pana Community Hospital?
Yeah, fairly new. We built it in 2019, and it is equipped with state-of-the-art ORs, fully integrated with updated technology. Basically, that's required to continue to provide top-of-the-line care with ample resources. And not only is it a beautiful surgical suite, but Pana Community Hospital has two of the largest ORs in the area. So we're pretty excited to brag on that. Also, with the surgical suite is our sterile processing department, staffed with experienced, certified personnel. And Pana Community Hospital is committed to providing safe, high-quality sterilization of our instrumentation and equipment for the safety of our patients. We really pride ourselves in our low infection rate. And for over 5 years now, we've partnered with a company called WTIM to provide the highest standard of care in sterile processing by practicing what we call an every load monitoring, which simply means indicators and tests are ran with every load that we sterilize to assure definitive sterility for each item that we use, again, for the safety of our patients. These factors definitely drive surgeons' desires to operate at our facility, along with our amazing staff, of course.
Is there anything else you'd like to tell everyone about the surgical department at Pana Community Hospital?
Sure. I'd really just like to emphasize how accommodating and convenient Pana Community Hospital is, and does provide the opportunity to stay local with your community for your same-day surgery needs. We provide safe environment that's convenient, high-quality care. Excuse me, before, during, and after your surgery, not only for our patients, but to be accommodating to the families as well. Our small setting provides a more personal experience with our staff and your surgeon, all while providing you your optimal care. We are known and treated with respect. The patients are known and treated with respect as a patient, not just another number like that of the larger hospitals. And we really value the opportunity to care for our patients here at Pana Community Hospital. If anyone listening would like more information or to find contact information, you can call the hospital's main line and speak to the operator, or those savvy with the computer can check us out online at our website at panahospital.com or our Facebook page, Pana Community Hospital.
Bob, you're an anesthesia manager for Pana Community Hospital. What can you say about the surgery department and surgical services that the hospital provides?
Yeah, I've been here with the hospital for several years, and many of the procedures that we're doing here at Pana Community Hospital are things that patients had to travel to those larger facilities to have done. And there's a lot of problems with that for patients. It deals dealing with the confusion of navigating a system that sometimes can be overwhelming. And quite frankly, I worked at one of those facilities for several years, and I can see the value of having a place such as Pana Community Hospital, where a patient can receive the same quality care with a more personalized approach, like Stephanie talked about. And with our expanded service lines, the first thing we had to do from an anesthesia perspective was to improve our staffing. With the expanded service lines with the orthopedic surgeons, things like that, we we really needed to bump up our skill level and things like that to provide those regional anesthetic options. And Pana Community Hospital was very aggressive in bringing in top-notch anesthesia and perioperative staff. That translates to a lot of years of experience to care from those people that they brought in. We're really wanting to make anesthesia as stress-free as possible for patients, and our team has the ability to provide that level of care that you would receive at a larger facility. We utilize the same practice techniques regarding regional anesthesia. So for shoulder arthroscopies, we can do the same type of anesthetic that you're going to get at a larger facility. We really working hard to eliminate the need for opioid consumption during the perioperative period. It's the big anesthesia initiative to work towards that. Additionally, here at Pana, we offer a PIC, midline vascular service. We've seen the value of this program, as many patients would have to travel to Decatur or Springfield to have this type of long-term device placed. And in the future, with the new MRI suite completion, we're going to be looking at providing sedation for patients who may not tolerate the MRI environment, and also looking into the possibility of working with our radiology providers to begin pain management program, which will be run through the anesthesia department.
I want to talk a little bit more about the MRI setting at Pana Community Hospital, but let me reintroduce you first. Take a break, come back, finish our conversation. You just heard from anesthesia manager at Pana Community Hospital, Bob Ludwig. He's here with perioperative services manager Stephanie Anderson here on the WTIM Morning Show. Your stream brought to you by Landmark of Taylorville, where you always do better with Landmark and People's Bank and Trust. They put people first.
WTIM.
It's time to play Trump or Consequences. Ready, Jill?
Let's go.
Thinking about Mary Miller and Rodney Davis in the race for Congress, who did President Donald Trump praise for fighting Joe Biden's, quote, runaway inflation?
Mary Miller, gotta be. Miller knows Biden is out of control.
Right, Jill. Next, who did Trump endorse for Congress?
Mary Miller. I know Trump backs Miller.
Correct. Miller has Trump's complete and total endorsement. Last question. Who is one of the very few Republicans in Congress to actually praise Joe Biden?
Who did that?
Rodney Davis.
So why would a Republican back Davis?
Good question. Because if you stand with Trump, Mary Miller is the right answer for Congress. Paid for by Club for Growth Action, clubforgrowthaction.org, and not authorized by any candidate or candidates committee. Club for Growth Action is responsible for the content of this advertising.
Listen for Taylorville Tornado baseball, softball, and Little League games on New Country 104.1 and streamed live on TaylorvilleDailyNews.com. You'll hear selected boys baseball, girls softball, and Little League games brought to you by Blakely Heating, Cooling, and Plumbing, Taylorville Vision Stores, Kirby Real Estate, and the senior citizens of Christian County, all in Taylorville.
The purple and gold are coming your way. The Taylorville Tornadoes are gonna do it today.
They encourage independence and enrich lives at Taylorville Estates Assisted Living. Here are some comments from a resident's family member.
My husband and I have peace of mind knowing that our loved one has all the support she needs in daily living, but mostly we have peace of mind knowing that she's happy and flourishing in her environment.
1 and 2 bedroom apartments are now available. Call Tony Clark for your tour of Taylorville Estates, 287-2222. That's 287-2222.
Local. For 26 years, Just Beds has been your local mattress store for 26 years, featuring locally made Bemco mattresses like Arctic Freeze and Max Life. That's a lot of local helping local. And all this month at Just Beds, you'll save big on Bemco. Twin mattresses for just $149. Queen mattresses just $229. As always, free delivery, setup, and haul away. Locally. Thank you for supporting Just Beds for 26 years. Keep buying local, friends. See the Yawn Exterminators at Just Beds on Montvale and Springfield.
Just Beds.
C&B Bank and Trust is helping to open doors for your wealth. Schedule your appointment with Victor Henson by clicking their icon at TaylorvilleDailyNews.com. Not FDIC insured, no bank guarantee, may lose value.
Hi, I'm Bob Raddings of the Bob Raddings family of dealerships. See our huge inventory of about 2,000 vehicles by clicking on our ad at TaylorvilleDailyNews.com.
Your information station, WTIM.
I'm Avery Cooper right here on the WTIM Morning Show. Welcome back. Landmark of Taylorville, proud to bring you this stream on TaylorvilleDailyNews.com's Facebook and WTIM TV YouTube. You'll always do better with Landmark, along with People's Bank and Trust, where they put people first. I'm here on the phone with Perioperative Services Manager for Pana Community Hospital, Stephanie Anderson. Great to have you here, Stephanie.
Thanks. Thanks again for having us.
And once again, Anesthesia Manager Bob Ludwig. Good to have you here as well, Bob.
Thank you.
So tell me a little bit about what a perioperative services manager does, Stephanie.
Sure, that's quite a mouthful, isn't it?
A little bit. Tell me a little. Break it down for me.
Okay, so perioperative basically is a comprehensive term that is the term that defines the care that's given before, during, and after surgery. So in our department, we have the pre-op area, which is where the patients come to be pre-op for surgery, the intra-op area, which is where they actually have the surgery, and post-op, which is where they have recovery. We also have, like I mentioned before, the sterile processing department. So perioperative services manager basically is just a comprehensive term to name the manager for each of the departments that make up our surgery department. I was a staff nurse here in surgery at Pana Community Hospital, started back in 2011, and back in 2020 took the surgery manager position, and the surgery department continues to grow and thrive, and it's been a very, very exciting experience.
Bob, I feel like anesthesia is a little bit more well known, but as an anesthesia manager, I would think, just based off your title, you're involved in a lot of surgeries and managing the anesthesia side, or are you more of an overseer of the rest of the anesthesists? Anesthesiologist is the right term, my bad.
Yeah, so we work very independently. Each provider does here. From a manager standpoint, it's really just kind of encompasses a lot of the administrative duties from the department, but I do provide a lot of anesthetic during the time here. We don't have, outside of myself on a daily basis, we have a lot of people that come in and help from hospitals such as St. Mary's, different places, staff that come from those different places. So we do pull from a wide variety of skill sets and lots of experience from those providers.
Gotcha.
And so, from my perspective, we've all worked very hard to gain the skills that we need to perform those specialty procedures that you would receive at a larger facility for the regional anesthetic or anesthesia. We train at many of us went to a class, I guess, up in Fort Worth, Texas, different places that you spend a lot of time learning those skills, and we've had a lot of success with our regional anesthesia, and everybody's able to provide those type of skills.
Good to hear. Briefly here, not a ton of time. Tell me a little bit about the new MRI suite being built.
Well, that's very exciting here at Pana Community Hospital, building a new MRI suite, which is going to be great for the convenience of our patients and community, as they're able to get their tests done locally and not have to travel out of town. So they'll be able to get their MRIs, labs, tests, and physical therapy all done here, which, from my end are all parts of preparing and recovering from surgery. So the construction seems to be coming along pretty smoothly, and I believe they're anticipating opening the unit within sometime in the fourth quarter.
That is Perioperative Services Manager Stephanie Anderson and Anesthesia Manager Bob Ludwig with Pana Community Hospital. Thank you both for coming on.
Hey, thank you.
Thank you.
WTIM.
With SRN News, I'm Rich Thomas.